Again, I'll start with the impact slide. This is one of the commonest lesions that you'll come across, and I'm pretty sure all of us may have had that. Cold sore. So this is a typical cold sore. And the most obvious place that it appears is, of course, lips. But if you pay attention to it, you will see over here, it is painful, and you'll see tissue death. So what now you need to know is that this is caused by a DNA virus. And we're going to talk about that. And we'll also talk about what is the clinical implication for that and how are we going to deal with it. Okay. The other important thing that you have to keep in mind, the medical terminology. So you can see from here, herpes, that's a herpes infection. So there's the name of the virus, herpes virus causing herpes labialis. That's the medical terminology, and in layman term, we call it cold sore. Now, DNA viruses, we'll pick up two major categories. Herpes simplex viruses, HSV, and varicella zoster virus, VZV. So these are the two important viruses that we're going to discuss today. And just a repetition of what we had earlier said when we compared RNA viruses and DNA viruses. This is type of a question that you can expect when you compare that. So which one is the correct answer in that? So that's yours, and find it out what's the correct answer. You have to go and read the last lecture and figure out. Of all the DNA viruses that we've been talking about so far, again, we just want to emphasize the medically important DNA viruses. So this is another question for you. I'm just giving you some of the questions. They are going to come in exams. Okay. Now, let's talk about the whole families, herpes viruses. So we know for now, cold sore. We talked about what yesterday? We talked about human papilloma virus. Today is the herpes simplex virus. Now, these are, as you can see from here, enveloped icosahedral, deltahedral capsids, and they have a double-stranded DNA genome. We already know that, right? And if I tell you that any particular virus is encoded by protein, so what is the immunological significance of that? Sorry? What is the immunological significance if I tell you a particular virus is encoded by proteins? If you want to say it louder. Higher virulence factor. Confusion. Yeah. Very good. Highly immunogen. We already talked about when we talked about hypersensitivity reactions. I said that proteins have highly immunogen. That's why you should have hypersensitivity allergy to protein. So immune response is robust. That's the important thing. So they have this tendency of manipulating our immune system as compared to anything else. So you are bound to have more allergy from protein as compared to carbohydrates or fats. That's what we discussed. Very good. Now, also keep in mind that herpes viruses, they also encode enzyme. One of the enzymes they encode is DNA polymerase. Most of the viruses are more virulent, are more pathogenic because they don't rely on borrowing protein-making enzymes from the host. They bring their own enzymes. So if they bring their own enzyme, they don't want to borrow from them and beg from them. So this particular virus is encoded by a DNA polymerase. It's going to promote viral DNA replication, right? And this happens to be the target when we talk of antiviral drugs. We talk about antiviral drugs in terms of those early phase and late phase, okay? DNA replication and capsid assembly occurs in the nucleus. That's another important thing. If you see that graph that one of the pictures I showed it to you, we had like bacteria in the end, and then DNA on one or RNA on one, and I said that they encode their genomes in cytoplasm, whereas the other one encode into DNA. So DNA, as a rule, as a principle, is something that the assembly occurs in the nucleus. And I also told you that the chances are that these viruses are to be small size. If you remember your cell biology, you have a nucleus and you have pores in the nucleus, and the pores are size specific, and there's a trafficking of proteins and messages in and out of the protein as compared to larger proteins. So this is like basically your biochemistry of protein kind of metabolism. All right. Now, the other important thing is that these are the unique features. The virus is released by exocytosis, right? No need for me to explain what exocytosis is, basic biology. Cell lysis and through the cell-cell bridges. When we talked about viral infection, I said there are two ways that viruses are going to export. So they start developing the cell. They can easily be exocytosed, for example, and bud out and do not damage the cell. The other one is they spread so fast, they explode the cell and lyse the cell. So that kind of infection we call lytic infections. They tend to cause more damage, okay? The other important thing is that, for example, you don't even notice that you have a cold sore, and slowly and gradually it expands. So it just affects one cell, and then virus will jump to the next. So how would a virus jump to the next cell? Basic cell biology. And I asked this question, I'm pretty sure, like a couple of weeks ago as well. Louder. You should know how to pronounce that. Say it again. Transposons? Transposons are for the genetic infection. There's no that. If anything needs to jump from one cell to another cell, they are cell adhesion molecules, CAMs. We talk tight junctions. Okay, so this is basic cell biology that you have to understand in order to understand tissue damage and not just understand pathophysiology. Okay. Okay. Correct. So you can see from here, and then these specific viruses can cause. Remember, I told you 4 different types of lesions that were lytic, persistent, latent, and immortalizing infections. So when I talked about general characteristics, I said that they can go and lyse the cell, they can disappear somewhere in the cells, and are persistent. Once you get infection, you have it for the rest of your life. As I said in HPV, there's nothing you can do. You cannot get rid of that. You cannot. Okay, once you get infection, you have it. And then the other important thing is we call latent. This means the viruses goes and hides and come back over and over again. Okay, so for example, once you have herpes virus labialis, so you have the virus now. You cannot get rid of that. You can get rid of that lesion, but it's going to stay. That's what I'm going to discuss today. That's the challenge for the antiviral therapy. Okay, and they are present everywhere, ubiquitous. Cell-mediated immunity is required for control. So we need to have cell-mediated immunity for control. Yesterday, when we talked of human papilloma viruses, I said that you need to have both. Okay. Now, I just told you that they encode proteins and enzymes that facilitate the replication and interaction of the virus within the host. So they are pretty malignant in terms of, because the purpose of viruses per se are they are parasite, they need to survive at your expense. They want to take over your protein manufacturing system and use it to make their own proteins, to make their own different parts of viruses so they can assemble it and grow. That's the whole idea. Now, one of the viruses, like Epstein-Barr virus and human herpes virus, are associated with cancers. So there's another issue. Yesterday we talked about HPV associated with cancer, but I just gave you two specific subtypes, which are serotypes. They have a higher incidence of causing cancers. Likewise, Epstein-Barr virus and human herpes virus, especially number 8. Yesterday we were talking about 11 and 16. So they are important and they are associated with human cancers. Yesterday I said there are 47 different types who cause, and then we have this graph listing all of them. Some of them have higher propensity to cause diseases. If you were to look herpes simplex virus under microscope, and you can see they are very, very well organized, these kind of particles. And if you look at the cell, you will see them sitting over there. We do look and find, especially for EM pictures. If you go a little bit more detail, right? Can anybody tell me if I talked about fried egg appearance of any other microorganism in culture? Okay, that's fine. I talked about mycoplasma, and that's where I talked about the fried egg experience. Now, if you look at this appearance over here, because the way we draw it like a cartoon way, kind of more symmetrical things, but still the nucleocapsid over here is symmetrical, but they have a membrane envelope again around them. And these envelopes have all those receptors. You can see all these receptors which are there, especially their proteins. We talked about glycoproteins. That's where these viruses stick to the cells. So these are specific receptors on the viruses, looking for very specific receptors on those particular cell for attachment purposes. But if you look under the microscopes, electron micrographs, this is how it looks like. Now, in the same thing that you saw over here, if you were to plot it for our understanding, so we kind of commit to our memory, you will see that there is a DNA core. So there is a DNA core over here, and then we have a envelope. So there's an envelope over here. DNA core has a capsid. So these are all protective. This is how it protects the genome. And then we have a bilipid layer, and all those tiny things that were jutting out of it, they are basically glycoprotein spikes. Glycoprotein spike, and these are, as I said over and again, there are specific names for that. As we move along, I'm going to talk about the names for that, because one of the things, if you remember, when I talk about antiviral therapy, I said the very first antiviral therapy target will be to stop adhesion of these viruses to the tissues. Okay. All right. Now, again, if you look at the electron micrograph, this is a real-time electron micrograph. This is a cell. And you can see the cell is releasing these herpes viruses. So you can see this is a DNA genome over there, and this Icosa delta hydral capsid, and they are glycoproteins. So if you were to look again, cross-section, cut it up, we call it Z-stacking in the electron micrograph, and you can see what is there inside. So you will see a pretty much picture, especially in terms of the structure element, because we want to stop the release of these viruses from here and stop attachment to the subsequent cells that we normally see. Now, the other important thing is that how would these viruses cause disease? So any microorganism causing disease we call pathogenesis. And again, if you follow the same routine, physiology of microorganism, epidemiology of microorganism, and pathogenesis, so that we understand what is it that causes disease. Now again, as I said, some of the viruses are, the property is called tropism. They have an affinity, a liking for oral, genital, and brain. So this virus is, for example, the virus over here on the lip, which is cold sore, it just appears over there, but it has a liking for genital and brain as well. So it can move from there to the genitals and to the brain to cause more damage. And the pathology that these viruses have, of course, is cell death, but in virological term, we call cytopathology. Cyto means self, pathology means, abnormality or damage. So cytopathology. And again, I just told you that the virus is very smart. Antibodies cannot go and penetrate and look for these viruses when they're hidden in the cell. So virus would not get released into the blood. It will jump from one place to another via CAM, cell-associated, adhesion junctions. And this type of spread is called cell-to-cell spread. So what will happen is, like for example, one cell will get infected, and it's going to pass it on to the other cell, and gradually the size of the lesion will increase. So if you look at the cold sore, if you pay attention, even the figure, you will see kind of pus-forming areas and lesion painful. So they kind of go to the, so it starts from the central, I would say, a ripple effect. So that's you throw a stone in the water, kind of expands. So that's what happens. And then this kind of pathology we call syncytia. Syncytium-like network. So they go and pass it on to, it's like a tenant sheet you're passing on to other people, to next to you. Okay, so pass on, that's what they do. Virus is called reactivation. Remember, I told you just now that some of the virus will go and cause a problem in your cell. Some of the virus will hide, right? And then wait for the time the immune system comes down. So for example, I mean, this is like common sense thing, and I don't want to go over and over and teach you, but I expect you to know that, for example, the person who has that lesion on the lip, okay? And before the person has this lesion, if this person was to touch another person, like for example, kiss a person or a child, or involve the lips in some sexual activity, so it's going to pass it on to the other people. Okay, so this is where, and not only on mucous membrane or what you call skin, but it's going to go to the brain. So this capability of the virus to hide, called latency, and wait till the time to reactivate. So if your immune system goes down, right, I'm going to discuss that, and you'll be amazed to know that what are the factors that a very benign cold sore can present with a very severe form of encephalitis. Okay, so this is what the link of the problem is. Stress or immune suppression. You understand immune suppression. I'm going to talk about stress today. Cell-mediated immunity is required for resolution and limited role for antibody. Because cell-mediated immunity, again, I don't want to go and teach you. It goes and break apart the virus, present it to the class 1, and CD8 cells will come and look at it. But you need a little bit of help from antibody. So cell-mediated immunopathological effects contribute to the symptom. This means that in order for this thing to occur, you have to have a very controlled cell-mediated immunity. Then we talked about proteins, we talked about the viruses. Okay, so that will make you wonder what will be the treatment for that cold sore. Okay, so first, again, some of the other important points that you can see if you were to look at herpes simplex viruses. Today I'm going to talk about type 1 and type 2. Though there are many, but type 1 and 2, and I'm going to talk about varicella zoster virus, and a little bit of Epstein-Barr virus, cytomegalovirus, and then again, some very specific viruses, human herpes 6 and 7. These are some of the very specific viruses that you will see that once you go into infectious diseases rotation or medical ward. Now, you can see that human simplex viruses from here, they were the first that we found out, and everything we talked about 1953 when we talked about the pox viruses. The problem for this virus is it appears on your lips, but it likes to sit in a cell in your body which are neurons. And what does that signify? Nerve. What will be the clinical picture? What is the symptom associated with a virus hitting the nerves? One at a time, yeah. Paralysis, okay, paralysis could be there. That's correct. What else? Brain is a neuron. It's already, pain, nerve pain, the biggest problem right now in medicine, no treatment, big problem, neurogenic pain. You can imagine it's uncontrollable to such an extent that we really sometimes we're hoping to give marijuana, morphine, even then doesn't help. So pain is a big issue because of the neurons. You have to keep that in mind. Right? Now, we talked about herpes 1 and 2. They have common characteristic. I'm going to talk about in the next few slides. Now, I think your book deals with that. Very good chart. Herpes simplex virus 1, herpes simplex virus 2. Both of them want to stay in the brain. Let's go on the top. This one more goes deeper in the brain tissue encephalitis. This one goes on the meninges. Okay? And then again, both of them, as you saw, there's no way of me telling just by showing you with a cold sore whether it is 1 or 2. The cold sore over here on your lip, the technical term is gingivostomatitis. That's the technical term for that. And then it can also go to your tonsils. It can also go to your lips. The one that I showed you is the labialis of the lip. But it comes to the lips. So what is the significance if you have an injury in the mucous membrane? What's the clinical impact of that? Huh? We talked about the barrier. The barrier between us and microorganism is intact skin and intact mucous membrane. Once the mucous membrane damages, what will happen? All microorganisms are going to flood in. Viruses, bacteria, and all of that. And also keep in mind that is a very slight injury. It doesn't have, ulcer is a big injury. Remember what I taught you? What was the bacteria I talked about, and I said that I also presented one of the psychological disorder and some of the things that people have in terms of extreme piercing. Remember that? Where you yourself deliberately are poking a hole in your mucous membrane and giving a free access to every microorganism which is there. Isn't the point? That's why we still argue whether CDC or government even need to control ear piercing or nose piercing as compared to piercing any other part of the body that may allow all these viruses to penetrate. This was on choice. You just invited the trouble. Does that make sense? Now, in this case, any particular mucous membrane you can see is involved. And then again, as I said about the sexual preferences of people, oral cavity, skin, and genitals. So you can see genital herpes. If it's that painful on the lip, you cannot imagine how painful that would be on genitalia. Okay? But it is very painful. Male and female genitalia, anal canal, and the commonest thing which I've seen, I'm going to scare you up, is very difficult for the health-related people to stay away from herpes which low. I'm going to show you some of the CDC pictures today. It's called herpes virtulo. It's very difficult because you cannot wear your gloves all the time. Is that the point? And it's so common that again puts you at odds. But remember the rule: you have to make your choices, good choices. All right. So pretty much what I said to you, it's just like a legend of what I just talked about. These viruses going for skin and mucous membrane. And also keep in mind that many of the times that we call microabrasions. So you will see as your skin intact or your mucous membrane intact, but it may not be. Okay, it may not be. So keep that in mind. It doesn't. I'm not talking about a major injury. I'm talking about even microabrasions that you may have to allow all these viruses to go into you. Another chart from another book that pretty much will give you same kind of impact, but a little bit in a different context. You can see from here, the rule is HSV-1 and 2 can infect same tissue and cause similar diseases, but some have predilection for the site and disease indicated. So some, they can kind of, swap over the site, but some of them are particular. For example, you can see from here, HSV-1 is more towards upper respiratory tract as compared to HSV-2. Okay, unfortunately, vitro is for both. I'm going to give you some pictures of that. Both cause genital, so this is be a part of STD. So this, I talked about bacterial STDs. Yesterday was the first STD, which is HPV. Today, HSV also an STD because of the sexual transmission. And the other important thing, which was not there in the second part, was neonatal HSV, because the baby pays the price of mother's doing. That's what we say. So if the mother has HSV in her vaginal canal, the baby is going to born and pass through that and acquire it. This is more to do with HSV-2 as compared to HSV-1. But the good thing is that it is tested as a pregnancy test, in the terms. Again, the question will be, I can give you the simple rule, and you will be aware any mother who's positive for vaginal or genital HSV would not be allowed to deliver the baby vaginally. So they will do a C-section, simple. Okay. Now, the important thing is what trigger. This is another term I'm going to use it. What triggers? So all of us, let's say, I'm not going to ask you to raise your hand, but all of us may have had this cold sore once in a lifetime, or our kith and kin or family members or whatever. But so this mean is there. We cannot get rid of it. Okay, but it tends to recur. Right? One of the things, if your immune system goes down, or you're stressed. Now these are known triggers. These like a triggers. Number one, UV radiation, skiing and tanning. So people who go to that tanning or go to that, they will trigger their existing HSV infection. Fever, when it comes in the fever, so those blisters that people see in the fever basically are called fever blisters, but they are HSV. Okay. Emotional stress, I used to say micro exam rather than the final exam. Because it happens, you just stressed out, just freak out for some reason. That stress is known. Final exam stress is known for people to have herpes infection, is known for people to have shingles, is a known fact. That's why it sits over there. I don't know the big date though, but anyway. Physical stress in terms of irritation, I taught you already. Women, very common in women because of the premenstrual question. Yeah. When you get? Yeah, it's the same thing. Any stress, anything stress level, it gives you common stress level. It may be different for different people. Okay, menstruation, but again, even you can see food spices, allergies. But these are the real stress: immunosuppression, transient chemotherapy. All these things are known to trigger. But the question is, it different in different people, right? So sometimes I ask a question. I say, 17-year male pharmacy student has a shingles. So what is the correct choices? So I give all these things, and one of these is menstruation. And guess what? Okay, so you have to be careful. Read the age, sex, and what am I asking before you make. So then there are, as I just told you, once you have it, it's your partner for your life. Lifelong infection. Recurrent disease is common, and then that is the problem: asymptomatic shedding. That's why you'll see some of the mothers, especially, not allow their babies to be kissed by every person, every stranger. You should be careful as well, because some. Okay. So these are real things because you're asymptomatic, but you're passing it on to the other people. All right. The other important thing is, if I ask you, HSV, is it a zoonotic disease? The answer is no. So you're not going to get it from pets. Okay. Now, if I would want you to encourage you to go to CDC, and it was one of my APP students' project, but it was too lengthy. I didn't purposely put it in there. But again, what I think the message I want to convey is for HSV is CDC maintains a record 1996. Is that correct? 66 to 2008. What's happening? It's increasing. But this is something you need to know. Again, CDC maintains record for gender and gender, sex, and age. And you can see from here, and again, same ethnic kind of disposition over here. You can see these are non-Hispanic blacks in all the age groups starting from 14 till after 50. This is non-Hispanic white, 14 to this. So this is like, I would say, 3 times more in non-Hispanic blacks of HSV infections. Now, the other question that people may ask you, and I've just quizzed you as well, that how would you catch virus? That's why, some of the infectious diseases, especially STDs, is where, I'll explain the microbiological or immunological definition of sex. So you'll see what does it mean in terms of us. So skin-to-skin contact, skin-to-mucus contact, mucus-to-mucus contact, and sharing of secretions. This is considered as good as having a sex, because you will acquire all those STD diseases. The question you have to know is, what are the secretions that will have most, right? And I'll just kind of pick up the things which are known and they are factual, and we teach them. The virus is shed in vesical fluid. This is a vesicle you see over tears, genital, and other secretion. It is spread by kissing, sexual contact, use of utensils contaminated with saliva. So it's there in the saliva. Mother to child during birth and postnatal. Mother to fetus in utero. And this is the scary part. This is US statistics. I will tend to take air towards the other side, right? 90% of adults have HSV-1. So you can imagine the impact, the health, and all these issues that are coming up, and it's beyond your control. And you and me, I didn't though, but you made a choice to go into health-related field with your own free will, right? And you cannot run away from patient. You can't run away from, and there are stories, and I'll give you the stories, especially, when physician and surgeon really get freaked out when they have to see and they know that there's a problem there, right? So they can't run away from responsibilities that they have. Okay, now continue with the incidence of especially genital herpes is a recurrent, lifelong. So if your partner has it, he has it, or she has it, and they're going to pass it on over and over and over again, right? So it's just like, I've seen STD. This is a surgeon journal statement. It is U.S. Surgeon Journal statement, which actually explains the impact of STD. That if you have a sex with a person, you basically are having sex with all the people with he or she has sex in the past. That's what she said, which is true. Because some of the viruses are lifelong viral infection, right? Then again, go back to the graph I showed it to you. We do have, if you remember, the graph I showed you was wavy. What does that signify? In technical term, this is called outbreaks. So if you see that kind of a thing, whereas in HPV, it was more of a stable thing. But this one, up and go. But it's up and go, but rising towards that. Every year, this keeps on, every year we add a new list. So you can imagine the impact of whatever is happening in terms of treatment, in terms of many things that we are doing. 50% are asymptomatic. 20%, these statistics, the CDC maintain it, but you can see that you are not a paranoid physician, because they're going to go and make sure that they look for antibodies or ask antibodies to be done just to be on safe side. But this is what it is in terms of the things. Okay, that's what I was telling you in terms of your understanding, that if somebody asks you and you want to make a legitimate or conscious or a kind of decision, so you have to keep in mind that these viruses are transmitted. And I just told you, mixing and matching of mucous membrane, and then again to each and every part of your body. And sometimes people may have HSV first, right? So what will happen is HSV will erode your skin, and it will invite HSV-1 as well. That's why, remember I said, we don't test people for STD for one STD. We test them for more than one, because the problem remains. You open up, you cut your mucous membrane, you cut your skin, you do something, and everybody kind of jumps on the wagon. And that's pretty true for all these viruses. HSV, though, is transmitted orally, where HSV is generally sexually. But again, these are qualifying terms. Remember, sometimes we say, when we say exception, generally, we don't, it is a disclaimer there, right? Doesn't prevent you from whatever is happening, so it should be both. Again, I think I don't want to go and tell you what the clinical syndromes are, but you can imagine, anything of that nature can go and cause problem and do that. Let me go and give you some of the CDC pictures, because part of it, as instructors, we may have to teach you. You may not see it because your ID, but if you do, then there's something that you should be taken care of, okay? This is another important thing for the clinical course of genital herpes lesion. And you can see from here, you get infected, like for example, genital herpes, sexual contact, and we're going to divide that into the primary infection. So the virus sits in your system for a couple of days, we call incubation. And then basically what will happen is that your immune system is going to put up a fight, and then you will have a sick-like pictures, and then eventually lesion will appear. And remember the rule, I said, any lump or bump or ulcer on genitals is serious. Okay, so that remains a rule. So what may happen is vesicle, wet ulcer, and crust. You may have tender lymph nodes, and you have a local kind of, but at the same time, you can see over here, virus shedding. So once your system picks up this virus, and what does this arrow signify? What does this line? If those of you know geometry, what does this line? Unending line, uninhibited, that's what it says. So this means you're gonna have it or pass it for the rest of your life. That's what the line is. There's no stop over here. You may heal though within 2-3 weeks, right? The other important thing is that for viral infection, we call prodrome. Like for example, if I'm going to have flu, I'll say, I'm not feeling well. It's like something coming up, like aura. I'm not feeling well. It's good. It's just like before you throw up, you see that kind of coming up, so you can prepare. And I mean, it's all recorded. I said to all the people, never eat and drink in my microbiology class, but I still see people taking coffee and whatnot. So they make the only thing I said at that time, please bring your vomiting bag with you in case I show you those nasty pictures, throw up, But there is an aura that comes before that. So that is called prodrome. So you see that prodrome over here. And then you may get local system. And this kind of a picture is again the clinical course, right? The important thing is incubation. The virus is spreading. It's taking time. Local system, systemic system over time. And also pay attention that in terms of days, right? So if this is unending line, this means once you have a sexual contact, you acquire that virus, you have it. Okay? And then again, it may recur over and over again. It may recur over and over again. I just told you that the primary infection, it may initiate by sexual contact. So mucous membrane will pick this up and pass it on to neurons. So you can see this is the pathways of herpes infection. It's going to go from the skin. You see from the skin? It's going to go from the skin. Skin is supplied by neurons. The virus is very small, tiny DNA virus. It's going to divide the nucleus. Size also matters. It's going to go and then come into your back, right? Come into the spinal cord. Good for it's just like permanent inhabitant of that. And then when the need be is going to come back over and over, there's nothing we can do with that so far. I can tell you that. Okay. It can come back from here, recur, right, and be shed off because it finds a permanent abode there. The other problems that we have in terms of HSV, HS2, I just give you a very good version of a layman's, a common cold sore. But if it happens, for example, in this toddler or a baby, so you can see oral herpes. This is oral herpes. It could be both from HSV-1 and 2. So from here, this virus, from here, you can see this lesion over here. This virus is going to go through the trigeminal nerve and go and sit in trigeminal ganglion, right? And then the trigeminal ganglion, this is a sensory pathway. I'm going to teach you autonomic nervous system. It's going to go over there and redistribute itself to the eyes and other part of the body, right? And the worst thing in herpes simplex infection as an STD will be that you have it on the genitalia, you have it on the breast, nipple of the breast, you have it on the eyes. You can imagine what kind of a pain are we looking at. Okay, so that's very severe. And also the problem is that the young baby, vertical transmission, she didn't do anything, but she just had to pay the price or whatever went. So example is that you can see the skin over here. Skin is supplied by the nerves, and these nerves are sensory nerves, very sensitive, very painful, and sometimes become so painful. I'm not going to discuss the treatment option, but they may have to cut the nerve or can do what not. But this is rare. So let me show you some of the CDC pictures. Hepatic vitiligo. I show the hepatic vitiligo over here. Infection of the finger. It often occurs in nurses or physicians. And I can tell you, I haven't come across any physician who did not have that. It's so common. There's nothing you can do because they have to touch. Suckling children as well. Herpes gladiolum, again, is there. Sometimes it says wrestling or rugby. So they can, anything that you rub against each other, mix and matching. It could be a sexual intercourse. It could be a game. It could be anything that kind of allows you are rubbing microorganisms into the system. That's what it is in terms of these people acquiring during wrestling or rugby. I'm pretty sure that they don't test you before that. Now, CDC care for the children. Of course, because of the pain. Just imagine that I just told you have to give marijuana to the patient, or what about the newborn baby? She can't even express herself for the pain. So these are classical presentation. I talked about physician, nurses, dentists. I should have pharmacists, so you can be safe. But again, the chances are that you get it from contamination of different parts of the body. And then again, neonates, if they have any immunodeficiency, they will have it, especially in the child I just showed you. It may be life-threatening. It really is life-threatening in terms of pain. So the moment you think of HSV, you think of pain. That's what I was trying to convey, because it goes and sits in the nerves. So how do you treat and prevent? So we use the nucleoside analogs that in with the viral DNA polymerase. We already talked about that. So what does the treatment? Treatment prevents or shortens the course of primary disease. But unfortunately, there's nothing we can do. Okay, so that's where public health and all these education come. And then one of the education, the CDC, they're all copyrighted. I'm going to show it to you. And you will, why do I show it to you is because sometimes you tend to take things lightly. Oh, it's just a rash. I'm allergic to that. No, who cares? No, it should not be like that. Even the best trained physicians would not even comment on that. They would rather send you the dermatologist. Things become very serious when it comes to viruses. That's why I want to give you a upshot on that. A neonate born to a mother infected with HSV. Of course, I mean, it's very easy for you to say, go for C-section. How many of them can afford to go for C-section? Things are not simple. So you can imagine the fate of the neonate. Finger when it gets infected. These are all copyrighted CDC. Lips, lesions on the tongue, HSV, lesions on the tongue. And this is probably a male homosexual. Herpetic vitiligo. So you will see these kind of thing, whitish thing. People tend to ignore that. These are little whitish things which is called herpetic vitiligo that come and go, and they're very painful. And they're very sensitive. They come and go. Sometimes they get infected. This is infected because remember, the viruses may have super added bacterial infection. They can, but like warts. And these called vitiligo, and they're very painful, and they are there. Okay. The other important herpes virus is varicella zoster virus. You see, mostly again goes for the neons. It has liking for respiratory route, and then it goes from there to the blood. And then when I tell you viremia, I don't need to tell you that it can travel to wherever it takes it to. So herpes simplex and herpes zoster. Keep that in mind. Shingle is becoming a big problem. I'm pretty sure you're working in what I call different Walgreens, and they are promoting shingles vaccine because of the pain. They advocate, and you can correct me, a couple of years they say above 50, above 60, no, they say above 50. But I can tell you that people 20, 30, 35, 40 also get infected with shingles, okay? Many a time, the presentation is like this. We call herpes zoster shingles. Does that click anything? I think I did teach that. I didn't teach, probably. Dr. Abir must have taught you about the dermatomes, because they go for the dermatome and they go for the nerve section. So this very defined infection that we normally see along the supply of the nerve. So it's a nerve tract. So because nerve comes over here and goes over here, in this one, herpes zoster shingles likes. Typical lesion, herpes zoster, it's like a blistery thing, but it's teeming with viruses. So even you touch it, you have it. So it's very painful over here, herpes zoster shingles. And herpes zoster shingle again, you can see from here, as I said, very painful for breast tissue. If it happens on male primary complex of the penis, again, very painful. For most of the people who get STDs and pass it on to the people, you can imagine the lesions on these parts of even in different formats for a typical STDs that people have, CDC. Multiple ulcers, again, as a rule, ulcers are not there, but they are there for HSV. On female, you can see from here, labia minora, genital herpes. Again, very deep ulcer in the vestibule, we call periurethral lesion in females. Again, STD. These are all STD curriculum slide from CDC. Even when we go to the upper part vaginal examination, you can see cervix pretty much infected with HSV. For shingles, it can also present in other formats. Sometimes it's presented that you may not have any clue. You can see from here, herpes on the buttocks. So it kind of looks like a burn thing, and it's teeming with, and again, you can see bordered by STD Prevention Training Center from CDC. And then again, people having oral sex may have it all over their pharynx, and part of that, you know, we call that oralis soft palate over here to the back. And one final slide is that what do we do? What do we do? And again, antiviral drugs are available. There's no vaccine available. Healthcare workers should wear gloves to prevent herpetic flow. I told you that how many times you put on gloves. People with active genital lesions refrain from sexual intercourse and lesions from the reepithelize. But there is little thing that people can do. Okay, so I'll stop here and take a little bit shingles in detail on Monday. And are there any questions? No questions? Okay, thank you.